I'm Heather Gagliano, and I want to thank you for joining us at the Hepatitis B in the U.S. Disease Burden Prevention and the Goal of Elimination webinar today with Dr. Crumbaugh with Dynavax. A couple of logistics I want to go through real fast is the presentation will be recorded and should be available later on in the coming weeks for anyone who might be missing the presentation. I'm going to ask everyone to keep your mic and your cameras off. Really helps with bandwidth here during the presentation. During the Q&A section, we will be able to unmute people. And if you have a question that you don't want to type in the chat but want to ask, go ahead and raise your hand and we will unmute you. If you do have any technical difficulties during the presentation, go ahead and use that chat function and ask, if you have any problems, let us know, like I can't hear you. Or if you do have questions, there is the Q&A section that can be utilized during the presentation and just ask throughout it. And at the end, we'll go ahead and address those questions. With that, I'd like to welcome Dr. Crumbaugh, who joins us from Dynavax. He joined Dynavax Medical Affairs team in April 2023 as the Medical Science Liaison for the Great Plains region. He joins Dynavax after 15 years of leadership and management for a community pharmacy. Dr. Crumbaugh is passionate about getting adults protected from diseases through immunizations and has been recognized nationally for his efforts. He is a past American Pharmacists Association Immunization Champion Award recipient and received an honorable mention for Immunization Excellence Award in Adult Immunizations from the National Adult and Influenza Immunization Summit. Dr. Crumbaugh earned his Doctorate of Pharmacy degree from the University of Arkansas for Medical Sciences, UAMS, College of Pharmacy, and a complete community pharmacy practice residency with Kroger and UAMS. So with that, thank you, Dr. Crumbaugh. I'll let you take it away.
Awesome. Thank you so much for, thank you everybody for having me and for attending today. So I'll just want to start off and say, thank you guys for attending and thank you to the Idaho Immunization Coalition for partnering with us on this webinar in honor of October, which is Liver Cancer Awareness Month. So why are we discussing hepatitis B for Liver Cancer Awareness Month? Well, the hepatitis B vaccine was one of the first vaccines to prevent cancer, liver cancer, caused by hepatitis B virus. Globally, 54% of liver cancer cases are caused by the hepatitis B virus. Here in the United States, there are 42,000 new liver cancer cases diagnosed each year, as well as 30,000 deaths. Now, not all of these cases are hepatitis B related. However, the ones that are could have been prevented through vaccination. So today we're going to discuss or review hepatitis B and its epidemiology, discuss hepatitis B elimination efforts, and review some of the ACIP recommendations for adults. We'll also talk really quickly about Hep B CPG, and then we'll highlight some key considerations for successful hepatitis B vaccine implementation. So, who do you think that the American public, including people in Idaho, are getting their medical information from? So from the media, Google, Facebook, maybe the White House. Just think for a second, how many of you have fielded questions regarding Tylenol or vaccines over the last few months? So I think we can all agree that there's a lot of information that swirls around and that patients are exposed to from many different sources. And unfortunately, many of those sources are uncredible. However, when making decisions regarding what they need to do, it seems that many people still depend on their medical professionals. And so many of you who are on the call today are probably that source of truth for a lot of patients. Also, did you know that survey data continues to show that the #1 reason people get a vaccine is because their healthcare provider strongly recommended one? Therefore, a strong recommendation from the provider is paramount. Hopefully, after this presentation, you'll have a better appreciation for the serious and life-altering consequences of hepatitis B and will be motivated to recommend this vaccine to all patients who are not up to date. So hepatitis B is a liver infection caused by the hepatitis B virus. Acute hepatitis B is a short-term illness that occurs within the first 6 months after someone is exposed. Some people with acute hepatitis B have no symptoms or only mild illness, such as fever, fatigue, nausea, and vomiting. However, for others, acute disease can cause a more severe illness that requires hospitalization. Hepatitis B is a vaccine preventable disease. However, new cases are diagnosed each day. It's estimated that up to 14,000 cases were diagnosed in 2023. Currently, there's no cure for hepatitis B infection, therefore making prevention even more important. Also important to note is that the hepatitis B virus is resilient and highly transmissible. It can survive for 7 or more days on fomites, and it's up to 100 times more transmissible than HIV. This slide shows why hepatitis B remains a significant clinical and public health burden. I'll highlight a few of these. So as we discussed at the beginning of the presentation, it's estimated that over 14,000 acute hepatitis B cases are diagnosed each year here in the United States. More than 70% of the acute infections occur in people aged 30 to 59 years of age. Progression from acute to chronic hepatitis B varies by patients. The current estimates are that 2.4 million Americans are living with a chronic hepatitis B infection. Consequences of chronic infection include liver cancer, cirrhosis, or need for a liver transplant. Of those adults chronically infected, up to 15% will die prematurely. This slide shows the natural history and progression of a hepatitis B infection. As I said before, some people with hepatitis B are sick for only a few weeks, but for others, the disease progresses to a serious lifelong illness known as chronic hepatitis B. About 5% of healthy adults exposed will progress to chronic infection. However, we see here that 20% of patients with immune deficiencies, 40% of hemodialysis patients, and greater than 90% of infants will progress to chronic disease. This high incidence of progressions for infants is one of the reasons the birth dose of the hepatitis B vaccine is so important. For people who are chronically infected, their lifetime risk for hepatocellular carcinoma is 15 to 20 times higher than those not infected. Among patients with hepatocellular carcinoma in the United States, 10 to 15% of those are infected with the hepatitis B virus. And 15% of adults and 25% of children who are chronically infected will die prematurely from cirrhosis or liver cancer. And remember, this is all preventable with a vaccine. So even though there has been a hepatitis B vaccine licensed in the United States since the early 80s, its complications continue to contribute to a high healthcare burden. Here in the United States, it's estimated that greater than $1 billion is spent annually on hepatitis B-related hospitalizations, and this excludes indirect costs such as poor quality of life, reduced economic productivity, and long-term disability. So hopefully you can agree with me when I say that this virus can be life-altering and sometimes life-ending. However, it is preventable. This data is collected from the CDC Viral Hepatitis Surveillance Report and shows the incidence of acute hepatitis B in the US by age group from 2004 to 2023. Although reported hepatitis B virus cases have continued trending downward since 2004, a majority of new cases since 2011 have been reported among those between 40 and 59 years of age. That is the green and the blue lines here. These increases may be attributed to this population not having had the hepatitis B vaccine as part of their childhood immunizations. Additionally, only about 30% of this population is reported to have received a complete hepatitis B series. In contrast, adults 20 to 29 years of age, which is this red line, had a 50% reduction in cases reported during those same years. The reduction in cases among this population occurred because many of these adults received the hepatitis B vaccine series as part of their childhood immunization schedule. The ACIP, or the Advisory Committee on Immunization Practices, added universal recommendations for childhood hepatitis B virus vaccine in 1991. There has been a decrease in reported cases over the last few years, maybe attributed to the COVID-19 pandemic, maybe not. However, until all the age cohorts incidence is the same as our 0 to 19-year-old population, which is this gray line, we healthcare providers still have a lot of work to do. So the key takeaway from this slide is that populations who have been part of the universal childhood recommendations are seeing a significant decrease, while patients who did not receive this vaccine as a child or who were born before 1991 are still at risk and make up a majority of the reported acute cases in the United States. So who is at risk for hepatitis B infection? Keep in mind, and we'll discuss here in a little bit, that anyone 19 to 59 is recommended to receive the hepatitis B vaccine regardless of risk. Healthcare professionals and people born outside of the United States are at increased risk for infection, as well as anyone traveling internationally. Additionally, patients with diabetes are at an increased risk for infection due to the use of diabetes care equipment, such as glucose meters, syringes, and insulin pens. Additionally, patients with diabetes are also known as hypo-responders. Therefore, it's important to get these people fully vaccinated prior to being diagnosed. However, Immunize.org states that risk factors for exposure are so numerous and diverse that most adults, even those who don't think of themselves at risk, may find themselves at risk at some point in their lives. And remember, anyone who's not vaccinated is at risk for hepatitis B infection. And there's no cure for hepatitis B disease, therefore prevention is our best treatment. The World Health Organization and the Centers for Disease Control, or CDC, have adopted the global goal of elimination of viral hepatitis by 2030. Why elimination? Because globally, chronic hepatitis B affects approximately 296 million people and contributes to an estimated 820,000 deaths every year. Elimination is possible, however, our low vaccination rates offer a wealth of challenges and opportunities. So to accomplish elimination, HHS has established five high-level goals, which are listed here. One is prevent new viral hepatitis infections. The best way to prevent hepatitis B is to get vaccinated. Two, improve viral hepatitis-related outcomes of people infected. And this is accomplished through our universal screening and referring people who test positive for treatment. Three, reduce disparities in health inequities, which is addressed by the universal vaccine and screening recommendation. Remember that risk-based recommendations favor patients who have an established relationship with a primary care provider. Four, improve viral hepatitis surveillance and data usage. Specifically, it calls for an increase in the proportion of persons with hepatitis B virus infection who are aware of their infection to 90% by 2030. It was 32% in between 2013 and 2016. Five, establish and increase collaboration of private and public stakeholders and discover and share best practices, which is exactly what we're doing here today. So now let's talk a little bit about hepatitis B vaccine recommendations for US adults. So this graph shows the number of acute hepatitis B cases over time. The number of cases peaked in the 80s and started to significantly decline in the 90s. In 1991, routine hepatitis B vaccine was recommended for all infants and has significantly reduced the number of acute cases. However, in 2011, adults at increased risk for hepatitis B disease, including patients with diabetes, were recommended to also receive a complete hepatitis B series. But as you can see, the number of acute cases continued to plateau despite these risk-based recommendations for adults. In 2022, the CDC updated the recommendations to include all patients 19 to 59, which we'll discuss further on the next slides. So universal hepatitis B vaccine recommendations have helped eliminate racial and ethnic disparities for children and adolescents. However, these disparities still exist in adults. As listed on the slide, the rate of newly reported chronic hepatitis B cases among non-Hispanic Asian Pacific Islander persons was 9.9 times higher than the rate among non-Hispanic white persons. Additionally, the rate of acute hepatitis B for non-Hispanic Black American adults was up to 1.9 times higher than the rate of non-Hispanic white persons in 2023. Risk-based vaccine recommendations can create disparities because they favor those with consistent access to healthcare, trust in disclosing stigmatizing risk factors, being aware of their risk, and health literacy. In April 2022, the ACIP updated the recommendations for hepatitis B vaccination to include all adults aged 19 to 59. This updated recommendation removes the risk-based assessment previously needed for hepatitis B vaccination, therefore clearing the way for all adults less than 59 to receive this vaccine. Adults aged 60 years of age and older with risk factors for hepatitis B, which we'll discuss on this next slide, should receive the hepatitis B vaccination. Additionally, and listed on point 3, the recommendations state that adults 60 years of age and older without risk factors may receive the hepatitis B vaccination. This language for adults aged 60 years of age and older without known risk factors is intended to prompt all providers to offer hepatitis B vaccination to patients rather than wait for a patient to request vaccination. This universal recommendation is very similar to what is currently existed for infants, children, and adolescents. Keep in mind that all adults aged 19 to 59 should receive a complete hepatitis B series. The risk-based recommendation only applies to patients over 60. A few of these risk factors include anyone being treated for sexually transmitted infections, patients receiving hemodialysis, people with diabetes, anyone traveling internationally, people who are infected with hepatitis C virus, and people with chronic liver disease. You can see the slide or the MMWR for the entire list. Again, the risk-based recommendation only applies to patients 60 years of age and older, and all patients 19 to 59 should receive a complete hepatitis B series, and anyone 60 years of age and older may also receive this vaccine regardless of risk. Currently, there are 3 licensed hepatitis B vaccines in one combination available for adults in the United States: Crumbaugh, Engerix B, and Heplisab B. Twinrix has both the hepatitis A and B. All of these vaccines contain the hepatitis B surface antigen and elicit an immune response which results in antibodies to the hepatitis B surface antigen. Engerix, Twinrix, and Crumbaugh also contain an alum adjuvant. Heplisab B utilizes a novel adjuvant called CpG 1018. Engerix and Crumbaugh are approved as a 3-dose series for most adults. Notice there's a higher dose and different schedule for patients on hemodialysis and with other immunocompromising conditions. Heplisab B is the only adult vaccine approved for a 2-dose series. The CDC does not give any preference to any specific formulation for healthy adults. Additionally, since hepatitis B vaccine is recommended by the ACIP universally for adults, most insurance plans will cover all formulations with no cost sharing. Starting in January of 2025, Medicare now covers hepatitis B vaccine for all beneficiaries who have not previously received a series. In this updated rule, CMS clarifies that a physician's order will no longer be required for the administration of a hepatitis B vaccine under Part B, as in boy, which will facilitate roster billing by mass immunizers for hepatitis B vaccine administration. Lastly, one note is that Prehebrio was removed from this table because it is no longer available in the United States. In December of 2024, the CDC published updated recommendations for hepatitis B vaccination in adults, specifically in pregnancy. These recommendations state that pregnant persons needing a hepatitis B vaccine may receive any of the currently licensed products, Engerix, Crumbaugh, Twinrix, or Heplisab B. Keep in mind that this vaccine, unlike other maternal vaccines, is not intended to provide protection to the unborn child. So regardless of vaccination status or if received during pregnancy, all newborns still need the birth dose of hepatitis B vaccine. The National Committee for Quality Assurance creates measures to drive improvement in healthcare and highlight top-performing healthcare organizations. The Healthcare Effectiveness Data and Information Set, or HEDIS, is one of these tools created and updated by NCQA. It encompasses more than 90 measures, including the Adult Immunization Status Measure. In January of 2025, the hepatitis B vaccine was added to the Adult Immunization Status Measure. To be counted toward this measure, adults 19 to 59 should either receive 3 doses of the childhood hepatitis B vaccine or completed a Hep B series as an adult, 2 or 3 doses. or have a history of Hep B illness or have a contraindication to the vaccine. Note that the AIS is a composite measure, meaning the percentage of adults who are up to date on all the included vaccines, not just the individual vaccines. Seroprotection following hepatitis B vaccination is defined as having vaccine-induced antibodies to the hepatitis B surface antigen level greater than or equal to 10 million international units per mil after completing a series. Current data suggests that protection from this disease lasts at least 35 years after someone has completed the series and achieved seroprotection, even if their levels drop below the correlate of protection. Most people will need to complete a hepatitis B series in order to achieve seroprotection. Now, a question that we get a lot is which patients should have their antibodies checked after completing a series. And generally, when we do draw antibody titers, we want to wait 1 to 2 months after completion of the series. And these are the groups of patients where we do want to check their antibody titers. So healthcare workers or people with occupational exposure, patients on hemodialysis, patients with HIV or other immunocompromising conditions, sex partners of hepatitis B surface antigen positive persons. But please note that this is not routinely recommended for routine adult vaccination. All right, so let's talk a little bit about Hep B CpG. So CpG is a novel adjuvant that activates the toll-like receptor 9 to elicit a targeted and robust immune response. This immune response mimics the innate pathways to outside pathogens. Currently, Hepatitis B is the only FDA-approved vaccine that utilizes the CpG 1018 adjuvant. And you can see here on the graphic for a more detailed explanation of its mechanism of action. So here is some important safety information for Hepatitis B, very similar to other products that are currently licensed in the United States. It's indicated for prevention of hepatitis B virus for all adults 18 years of age and older. Do not administer this vaccine to people with a history of severe allergic reaction or previous dose of any hepatitis B vaccine or component, including yeast. Make sure that you have appropriate medical treatment and supervision available for patients in case you need to manage anaphylaxis. That's in general for any time you're administering a vaccine. Immunocompromised patients, including patients receiving immunosuppressant therapy, may have a diminished response to this vaccine. Hepatitis B is a long incubation period. Therefore, this vaccine may not prevent infection in individuals who have an unrecognized infection at the time of vaccine administration. The most common patient-reported adverse reactions reported within 7 days of vaccination were injection site pain, fatigue, and headache. There are no adequate and well-controlled studies of Hep B CpG in pregnant individuals. Available data, and primarily in individuals who received one dose in the 28 days prior to or during pregnancy, do not suggest an increased risk of major birth defects and miscarriage. It's also not known if Hepatitis is excreted in human milk, and vaccination with Hepatitis may not result in protection of all vaccine recipients. So it is 2 doses administered 1 month apart. It is injected intramuscularly. Each half-mil dose contains 20 micrograms of the hepatitis B surface antigen and 3,000 micrograms of the CpG 1018 adjuvant. It's also supplied in pre-filled syringes and is stored in the refrigerator like most other vaccines. So there are 3 phase 3 clinical trials that evaluated the non-inferiority of Hep B CpG to Hep B ENG or Hendrix measured by seroprotection rates. The trials also evaluated the safety of Hep B CpG compared with Hep B ENG. Primary endpoint of seroprotection from the hepatitis B for all studies was defined as vaccine-induced anti-hepatitis B surface antigen antibody levels greater than or equal to 10 million international units per mil after completing a series. So study populations for these trials is included on the slide. The first study included healthy adults aged 18 to 55. The second study included healthy adults aged 40 to 70. And the third included adults aged 18 to 70 and also included those populations that are considered hypo-responders for hepatitis B vaccine, such as patients with diabetes, people who are obese, smoke, males are also hypo-responders. All studies excluded people who had a current or previous hepatitis B infection or vaccine, had HIV, immunosuppression, or history of autoimmune disease, and who were pregnant or breastfeeding. So in my practice, when looking at studies, I always zero in on a study population that's similar to my population that I would see in my pharmacy. So take just a moment and see if any of these patient populations included in these studies is representative of your current practice. This slide shows the data and primary endpoints from 2 of the 3 pivotal trials. On the y-axis, we have the percentage of patients in this study who achieved seroprotection, and the x-axis is time in months. The blue line represents patients who received Hep B CpG, and the gray is Hep B ENG. In the first study, in adults 18 to 59, by month 3, 95.1% of patients who received 2 doses of Hep B CpG were protected versus 81.1% at month 7 after receiving 3 doses of Hep B ENG. The second study in adults aged 40 to 70, at month 3, 90% of patients who received 2 doses of Hep B CpG were seroprotected versus 70.5% of patients receiving 3 doses of Hep B ENG. One other issue that I found interesting was the seroprotection rates for each vaccine prior to series completion. So we know that most patients will need to complete the series in order to be protected. And if you look at the data from these trials, 1 month after 1 dose of Hep B CpG, only about 20% of those patients were seroprotected. Additionally, 1 month after the first dose of Hep B ENG, less than 5% were protected, and only 20 to 30% of those patients who received 2 doses of Hep B ENG were protected. So again, I think this data really is really compelling to understand how important series completion is for hepatitis B vaccine. So we mentioned earlier, we have some groups of patients who are less likely to achieve seroprotection, and we refer to these patients as hypo-responders. So people who are over the age of 40, male, people who are obese, have diabetes, smoke, or have chronic illness. So these results are from the third pivotal trial that assessed seroprotection rates of those receiving Hep B CpG versus Hep B ENG who are 18 to 70. Also included in this population, as I said, were people who can be classified as hypo-responders. So from the 3 pivotal trials for my practice, this population best represented who I was seeing on a day-to-day basis. I know you're probably surprised. We do have people who have diabetes that live here in Arkansas, and I'm sure that you have many of those patients in Idaho. And so just remember that that is a patient population that is hypo-responsive to hepatitis B vaccine and other vaccines as well. So in this trial, patients with diabetes, the seroprotection rate was 90% compared to 65.1% for the 2-dose versus 3-dose. Looking at patients who are 40 to 70, so these lines right here, the line in this table here, and this is where we're having an increased incidence of acute hepatitis B disease from the earlier slides. These patients, their seroprotection rates for the 2-dose series range from 91 to 97% versus 72 to 84% with the 3-dose series. This trial found that Hep B CpG had higher seroconversion rates than Hep B ENG in adults with factors known to reduce the immune response. This table shows a safety profile from all 3 pivotal trials. HPV 23, or the last trial, only reported unsolicited medical attended adverse events. All 3 studies showed a similar safety profile for Hep B CpG as compared to Hep B ENG. All right, so now let's talk about some considerations for implementation. So we talked about how important series completion is in order for someone to be protected from hepatitis B virus. And on this slide, there's 6 studies that assess what the real-world series completion for the hepatitis B vaccine may look like across several different practice settings in the United States. The blue and green bar represent a 3-dose series completion, and the orange bars show a 2-dose series completion. Three-dose series completion rates range from 22 to 54% depending on each study. Also, I would call your attention to the Bruxford study, which is this last one, which evaluated series completion of a 2-dose and 3-dose series. This study evaluated over 10,000 patients who completed the series within 1 year at Kaiser Permanente in Southern California. The 3-dose series completion rate was 32%, while the 2-dose series completion rate was 61%. All of these studies show suboptimal completion rates and therefore emphasize the need to continually assess patients' vaccine status as well as provide reminders or recalls for hepatitis B series completion. The National Health Interview Survey is a continuous cross-sectional national household survey of non-institutionalized U.S. Civilian population. These interviews are conducted over the course of the year in a probability sample of households. Hepatitis B vaccination coverage is assessed every 2 to 3 years. For hepatitis B vaccination, respondents were asked if they had ever received the hepatitis B vaccine. This survey data is broken down by all adults born before 1991, which is when the U.S. implemented the hepatitis B vaccine for all infants and children. As you can see, the rate of hepatitis B vaccination continues to be low, depending on the population between 30 to 40%. Therefore, for every 10 people you see in your practice that are born before 1991, only about 3 to 4 of those patients are up to date on their hepatitis B vaccine. A nationwide Harris poll was conducted about this time last year, and it included just over 2,000 U.S. adults. They were asked a few questions regarding their knowledge regarding hepatitis B disease, including serious consequences, vaccine recommendations, and if they had discussed hepatitis B vaccine in the last 5 years with their provider. 58% of people surveyed did not know chronic hepatitis B can cause liver cancer. 20% accurately understood that hepatitis B vaccine can prevent liver infection. More than half did not know that the hepatitis B vaccine is recommended for all adults aged 19 to 59. And lastly, probably the most important data point for us to concentrate on is that only 56% of patients answered that or 56% of participants answered that they had not discussed hepatitis B vaccine with any healthcare provider in the last 5 years. So what should we as healthcare providers do as a result of this data? If elimination of viral hepatitis B is our goal for 2030, we must educate each of our eligible patients about the disease and vaccine. Remember, if the provider makes a strong recommendation to get vaccinated, most people are going to accept it and get vaccinated. Some may need to know why you recommend it, and these answers should be tailored toward the individual patient. Another important updated CDC recommendation to assist with hepatitis B elimination is listed on the slide and states that all adults over 18 years of age and older should be screened for hepatitis B infection. The screening should include the triple panel, which includes the hepatitis B surface antigen, antibody to the hepatitis B surface antigen, and the total antibody to the hepatitis B core antigen. Many people who are infected with hepatitis B virus are unaware they are infected. Also, 2 of the goals from the viral hepatitis elimination plan include identifying people infected with hepatitis B virus and getting them treatment, in addition to improving disease surveillance. These guidelines are intended to identify patients who are infected and refer them to treatment, not to assess if they have been vaccinated. Vaccination status is assessed by a completed series, not serological testing. Additionally, these recommendations also state that anyone who requests hepatitis B virus testing should be tested. Also note that screening should not be a barrier to hepatitis B vaccination, especially in populations that have decreased engagement with or access to healthcare. So this slide lists some considerations for implementing the new immunization and screening recommendations for hepatitis B. Remember, all adults 19 to 59 should complete a hepatitis B series, as well as patients 60 years of age and older with risk factors. Additionally, anyone 60 years of age and older without risk factors should still be offered this vaccine. All adults 18 years of age and older should be screened for hepatitis B. Screening should include the triple panel, as we discussed earlier. Screening and vaccination can be done at the same visit. However, blood must be drawn prior to vaccination. Remember, all of the licensed hepatitis B vaccines contain the hepatitis B surface antigen. Patients who decline screening should still be vaccinated. And as I said before, hepatitis B vaccine should not be delayed due to patients refusing or not being able to get screened. But just to kind of close this out here, listed on this slide are a few strategies to assist providers in implementing Hep B vaccine into their practice. So identifying patients, this has been made easier with the universal recommendations. Remember, people born before 1992 did not have the routine hepatitis B vaccine series as part of their childhood schedule. Utilize technology and immunization registries. I know in Idaho, you guys have a pretty robust immunization information system. And a lot of those IASs will integrate with the electronic health records. So use that data to identify patients who are needing vaccines. A strong recommendation from a healthcare provider is also very important. Remember, some patients need to hear that strong recommendation multiple times prior to taking action. And surveys continue to show that the number one reason patients have not received routinely recommended vaccines is because their healthcare provider did not recommend they get vaccinated. And lastly, specific for hepatitis B, make series completion a priority. Whether it's a patient who is getting all of their doses at your clinic or pharmacy, or if they've started a series at another provider and are following up with you for additional doses. So in closing, I'll just say that, the recommendations for adult hepatitis B vaccine, again, we have universal recommendations for adults. So what that means is all adults 19 years of age and older should receive a hepatitis B vaccine, and those over the age of 60, regardless of risk factors, may receive it. These recommendations don't apply to adults who have completed a hepatitis B vaccine series as a child, but remember that that was not implemented here in the United States until 1992. So our goal is elimination by 2030, and our keys to success are a universal adult vaccine recommendation. However, now that these recommendations are in place, we must implement these within our daily practice. So I'll close with a story from Senator Cassidy, who is from Louisiana, and he had some opening comments during the HHS Secretary of Confirmation hearing. I think they're really applicable to what we're talking about today. And I quote, "Before I entered politics or even thought about running for office, I practiced medicine for 30 years, working in public hospitals in Louisiana, specializing in liver disease, caring for those who otherwise would not have a specialist. In the early 2000s, I was loading my patient, an 18-year-old young lady, into a medevac helicopter. She had acute hepatitis B. Barely an adult, her entire life ahead of her, and all the hopes and dreams she might have wanted to cram into it, wiped away if we didn't get her to the LSU hospital in Shreveport for an emergency liver transplant. A transplant, an invasive $250,000 surgery in 2000 that, even if successful, would leave this young woman with a lifetime of medical bills. As I saw her take off, I was so depressed. A vaccine could have prevented this all. My hope is that you all have a new appreciation for the potentially life-threatening vaccine-preventable disease that the hepatitis B virus can cause." And now I'll turn it back over to Heather for some more information.
Thank you so much. Before we go into questions and answers, I'm going to really quickly share a little bit of information regarding the importance of birth dose Hep B vaccine. So thank you, Dr. Crumbaugh, for sharing about all of that great information about adults and hepatitis B. So it is Liver Cancer Awareness Month, as you mentioned. There's some information I wanted to share, is also adding in that adults aren't always aware that they're infected, as you had mentioned, that they might not necessarily be symptomatic. And, with that, our infants are so vulnerable. And if, as you had mentioned earlier, if they're exposed at that young age, they are really at risk for developing that chronic hepatitis B. And I think the statistic here on the slide is that 90% of newborns and infants infected with Hep B will develop chronic hepatitis B, and 1 in 4 of those will unfortunately pass away from the disease. And I've had people talk to me about, well, why do we need universal birth dose if it's, we're testing people, we're vaccinating parents? And I think there's some good points to put into there as well. Clearly, as you had shown out, yes, we are vaccinating, but there is a large gap in what we could be doing and what is being done. And it's important to talk about that women might not necessarily have prenatal care. So 1 in 14 infants born in the US actually are receiving 0 or very late prenatal care. And so we're missing some of those moms who maybe could be vaccinated or tested during that time. And the vaccine program with universal vaccination for children, as you had mentioned, has been so successful. Between 1990 and 2002, there were over 13,000 cases of acute hepatitis B in children under the age 18 and under. But we only had, in regards to perinatal cases in 2021, less than 20, and 13 cases in 2022. So really, this has made a pretty dramatic difference in our children's lives. In doing a little bit of research on this, I was able to see some case studies also of children who were in preschool and they bit other kids, which unfortunately happens. And they had unfortunately passed hepatitis B onto other children. I also want to mention a family that I know who is very open about this, that they unfortunately were exposed to hepatitis B through improperly sterilized and sanitized dental tools. And so their whole family had to go through a process after being exposed, and that was adults and children. So really want to share that out. So thank you so much, Dr. Crumbaugh, for taking the time out of your day to come and educate us about hepatitis B, the disease, vaccination, and different ways, that multi-level approach to, not only testing, vaccinating, prevention is huge, into this serious virus that unfortunately can have pretty detrimental consequences for people. So thank you again, everyone, for participating. Please take the time to take the survey. It really helps us as an organization improve our webinars so that we're getting things that you're interested in. I know the speaker would appreciate any feedback too. And with that, we'll give you about 7 minutes back for your day, and have a fabulous Thursday. Thank you, everyone.
Great. Thanks, everybody.